So without further ado, I'm going to introduce all the different panelists, the 5 panelists that we have here today. I've asked them to be really brief. I'm sorry about that, but this is just to kind of introduce them to you. And then we're going to open it up for some questions that you might have, asking them about their experiences, about how they learned about these things or what some of the pitfalls are. And then, as I said, then I'll open it up later then for Kim and Johanny to talk about their organization. So first off, I'll name the panel. Indira Mysorekar. She's a research scientist and a leader in her department and field more broadly at Baylor College of Medicine. And she's been affiliated with the CAIRIBU community for a long time. She was a PI of a P20 center, actually, when she was at Washington University. And she's now very involved in CAIRIBU research in interest groups on aging and on the urobiome. And then we have Nicole De Nisco, who is also an independent investigator, very successful urobiome researcher. She's at the University of Texas at Dallas. She's also got an adjunct faculty position at UT Southwestern, and she'll be describing some of her experiences in acquiring funding to us. And another Nicole Gilbert from Washington University is with us. She's also involved in the CAIRIBU community through the Urobiome Initiative. And of course, we tap everybody as much as we can for various leadership and speaking opportunities, as we've done here with her today. We also will be joined by Zohreh Izadifar. She's from Boston Children's Hospital, Harvard University, and she is also part of the CAIRIBU community through another research interest effort that we have going on. So we've gotten to know her over the last couple of years. And then finally, Tanecia Mitchell. She is an independent investigator, scientist at University of Alabama at Birmingham. She was actually part of a P20 center that actually had in the CAIRIBU community. And of course, as always, or as we encourage, has stayed with us and continues to be active. And we tap her for her expertise in various areas. And then after that, after we hear from them, I'll introduce Kim Hollander and Dr. Johanny, can't say the last name, Kugelman-Tonos, to talk about their respective organizations. So I'd like to open it up. Again, I've asked these people to be very brief, couple of minutes at most, and we'll do a round robin, and then I'll open it up for questions of them. And I'd like to start with Dr. Mysorekar.
Thank you very much, Chris. This is great, and thanks for having me on. So I think this is a very important topic along the lines of, we're typically trained only to apply for NIH grants, but I think learning how to apply for foundation grants is a step towards being able to be very big picture about what is our biological question that we're trying to address, and more about us, like how we are the right people to address that biological question. And that mindset is very important as we, sort of hone that pitch towards either venture capitalists if we're developing a company, or to philanthropy if we're trying to get donors interested in our work. So rather than the burden of huge amounts of data and evidence leading to our hypothesis, this is the question I'm going to answer. And so I think learning to apply for foundations, which focus more on who you are and your question are great. So I've had foundation funding from March of Dimes and Burroughs Wellcome Fund. So I'm happy to weigh in as needed. Thank you.
Fabulous. That was perfect. Next, I'd like to call in Dr. De Nisco.
Hi, everyone. Thanks, Chris. Yeah, so my first grant was actually a foundation grant. And so I think, one of the reasons that we don't look at them as much is because they usually are for less amounts of money a lot of the time, that much lower indirects or none at all. But I think it was that grant. So I got a 3-year grant from the Welch Foundation, and that's a Texas thing. So, but it's chemistry. So it's for chemistry research that involves chemistry, right? And so you wouldn't necessarily think like, oh, urology research involving chemistry, but that's where I kind of had to think outside of the box and convince them. And luckily, the reviewers that year liked the project, which is another topic to talk about with foundation research, that you often get zero feedback on your applications. But this project was my work on glycosaminoglycans, right? And so that, looking at their chemistry and kind of pitching it from that angle where it's like more of a chemistry, biochemistry question and how the microbiota are utilizing them in their metabolism. And so that was a way to kind of pitch it so that would be interesting to them, and that we're using, mass spectrometry and things that would be approaches that they would appreciate. So yeah, and then getting that grant has spurred I'm on an R01 with Chelsea Armbruster, where we're now have an NIH R01 studying these glycosaminoglycans together. So it can be a stepping stone. I think it's something I really like to kind of drive home, especially for newer investigators, as like your way to getting those larger grants. So yeah, so happy to offer that perspective for this.
Wonderful, really good pearls of wisdom here. Next, I'd like to call on the other Nicole, Dr. Gilbert.
Thanks, Chris. Yeah, so a lot of my experiences have echoed what's already been said. The foundation grants that I got actually were during my training period, so I can provide some perspective on that. I got a pre-doctoral and a postdoctoral fellowship from the American Heart Association. And, it's already been said that, thinking outside the box and looking to foundations that you might not otherwise have considered. I didn't work in a lab that studied anything related to the heart for either of those fellowships. My pre-doc, I studied a pathogenic fungus that causes meningitis. And then the postdoctoral fellowship I got when I was studying group Streptococcus, E. coli, co-infections for UTI. And so, I was able to pitch the project as important for the AHA because of, hospital patients or transplant patients were more susceptible to these infections. And it was already mentioned before, but that, these foundations are oftentimes more funding the researcher, especially at training stages. So, the project is important, but if it's at all related and you can really pitch that this is going to develop a scientist that's going to continue on in, the biomedical field, is a lot of times what they're looking for. And another thing that I can offer perspective on and encourage everybody is to just talk to as many people as you can, even in other departments, if you're a trainee, talk to students and postdocs, even outside of your department, to learn about what some of these other resources are. And I think you'd be surprised how often you hear this same kind of story.
Wonderful, excellent. Next, I'd like to call on Dr. Izadifar.
Hello, thank you, Chris, for having me on. Well, my experience with the foundation grants and philanthropist grants was mostly, again, from my training time. I had multiple small ones as a trainee during my PhD, and then more larger foundation grant was on the Gates Foundation when I was at the Beast Institute. And then now I have another one when I started my independent lab at the Boston Children's from Massachusetts Life Science Center, which is a Massachusetts-based foundation. And most of these grants that I recently worked on and were part of, they are very much translational oriented. And my perspective would mostly be on how foundations that are very mission oriented and they are kind of translationally funneled in their approaches, how we can kind of tap on them and relate them to the research that we are doing. The smaller one, philanthropist one, as Nicole Gilbert mentioned, they are to help younger researchers to get through their programs. But as you move on to a more independent position and looking for the bigger grants, then it goes to the foundation and philanthropic monies that they really want to make an impact translationally in some areas. And then your research needs to be oriented with what they are doing, or at least you that's where maybe I can provide some input. And because I'm new to the CAIRIBU community, I would like to give a little bit of what I do. I'm a biomedical engineer by training. And what I mainly do is to develop physiological and advanced engineering-based model systems to study human diseases. And now my lab is working on creating mucosal interface tissues, including the bladder, urethra, and the lower reproductive tract. So that's my background.
Thank you. Really excellent, again, pearls of wisdom here. And finally, I'd like to ask Dr. Mitchell to speak.
Thank you for having me, Chris, and hi, everyone. It's a pleasure to be a part of this webinar today. So I'll just give a very brief snippet about me as well before I talk about the foundation grants that I've received. So I am an associate professor at the University of Alabama at Birmingham, and my research focuses on understanding the role of diet and how that impacts immune response as well as metabolism and kidney stone disease. I'm also interested in studying metabolism and other urological conditions as well. And so I actually received my first foundation grant, and only foundation grant technically, a few years ago. Can you hear me okay, Chris? Okay, I received it a few years ago from the OHF ASN, and that was the Kidney Cure Transition to Independence Grant. At the time, I had a KO1 and an R03 from the NIH, and it was in the middle of the COVID pandemic, and I was trying to transition into receiving R-level funding. But of course, like everyone, we had limitations. We weren't able to be in the lab and generate a lot of preliminary data. So I'm really grateful for the opportunity to receive that award because it gave me more time to actually generate more data, as well as to really come up with a stronger story for my R01 application. So I can talk a little bit more about just identifying the grants that really fit your research, really making sure that your research is in alignment with the mission of the foundation. I think that's the biggest thing that's really important to consider. But I can share more comments as we continue to go forward.
Thank you, panelists. That was really excellent. And I just want to tell the community that, remind them, I think Marianne already said this, but we're recording this. We usually do a summary, like a one-pager or something after this so people can read something really quick, bullet points. And I anticipate we're going to do something like this again because there's a big crowd here signaling that people are really interested in this. And there's a lot of talented and experienced people within the community. So we might do this again involving other people. So for now, for the next 10 minutes or so, I'd like to do questions and thoughts and perspectives from the community. Please feel free to direct a question to an individual or to the whole panel. And then after that, I want to give ample time to the organizational representatives that are here to give talks after that. So would anyone like to open up with a question or insight or just some comment? If you do, feel free to just unmute yourself or raise your hand.
Hi, Chris. I've got a question, if I can.
Yes.
So I feel like, when we're searching for NIH grants, it's easy to go on the NIH website and you can kind of search. Is there any sort of equivalent or some way to kind of just like see the different options for the foundation grant somewhere? I feel like I have to like know the foundation in order to go and hunt down a foundation grant.
Such a great question, Dr. Kelly. This is Mary Ellen Kelly's from Duke University. She was a K-12 scholar there, and that was her entree into the CAIRIBU community, and she remains involved as well. That's a great question. We are trying to make the CAIRIBU website that place. Theo is here. Theo Ng is here. He's new to our staff, but I've asked him to become an expert in this. It's a tall order, as you might know, but this is our goal, is to be sort of a one-stop shop, if you will, to be that central clearinghouse, to be that place where we offer, insights into all these different things. I don't know that that's an attainable goal, but I know that we will try our best to get there. And you can look on our website now to see the progress we've made. It's better now than it was before, and we'll keep going. And we're going to be asking, I know I've asked Theo to eventually, we want to get input from you guys. Maybe some focus groups we'll do or something where we ask you, is this the right way you want to see these things? Are we putting it out there in an easily readable format? We'll be experimenting, but great question, Mary Ellen. Does anyone else have any thoughts on that? Otherwise, Indira, go ahead.
Yeah, I just wanted to say that I know a lot of people are not going on X anymore, but Johns Hopkins, one of the deans at Johns Hopkins, he maintains a very, very large data set of every foundation grant in the entire world, practically, with details about eligibility. And that's a great place to look at. And we have our editor review that routinely and put together a small list for our trainees. So,
such a great comment. Thank you. Kugelman-Tonos just put in a little link in the chat that she wants you to check out, and then Theo put in a link to the CAIRIBU extramural funding page. And we should all probably, and maybe on the CAIRIBU page, we will highlight that Johns Hopkins site that you just talked about and make sure that we are getting that out to people as well. So thank you. Other
Yeah.
questions, comments?
Oh, I
Go
had
ahead.
another resource. Sorry. There's another resource, and it might depend if your institution is subscribed to it or not, but there's something called ProQuest. So there's a website, it's like pivot.proquest.com, and you can actually put in the information about the kind of research you do, and it will give you alerts about upcoming grant opportunities. And this is where a lot of the, like, it has all of the, a lot of the foundation ones. It will also have like NIH. But yeah, I will, like, a lot of the random foundation ones that kind of hurt, like I'll get some alerts from here, from ProQuest, and that's something I signed up for like as a postdoc, I think. So yeah, that's another resource I can put in the website if you want. It's run by Clarivate, you know, I think.
And
Yeah.
Josh Karan did put in a link to that. Indira put in a. You guys got to open your chats because there's some
Oh,
real,
good.
real cool stuff coming in there, and we will
Yeah,
capture all
okay.
this
Yeah,
as
so yeah,
well.
you can follow Josh's link. That's the one I'm talking about. Yeah.
Perfect. Thank you. And Indira put in the Johns Hopkins one. Keep it coming, you guys. Other comments, insights, questions?
One of the things I found kind of helpful was if your research interest has overlap with other areas, and some of the foundation are specialized in one area, like for instance, women's health. So if your research has a branch and application in women's health, and you go to the space of like industries and some of like the companies and foundations that are interested in women's health, then they will be part of a kind of a consortia that they will share this information. For instance, the one that ARPA-H had for, you guys probably know, for the Sprint for Women's Health last year. So they had this group that people could all go in there and sign up. So their institution could sign up to be part of this consortia. And a lot of information could be shared about new funding opportunities. But it's all translational, because some of these foundation want translational work, but it was focused on women's health. So if you have a specific interest in your research, for instance, for pediatric women's health or aging, there are some of these foundations that have overlaps, and then they cover those areas. So it will be good to tap on like other communities as well to see if there might be opportunities as well.
And on that note, I'll just throw in, I heard it said somewhere that autism was going to be a big area of research. Anyway, there are some intersections with urology and genitourinary conditions in that. So these announcements, although they might not seem like they're relevant to us, I think what you all are saying is go in there, and as Indira said earlier, tell them why you're the one why your idea and why it makes biological sense for your idea to be included within this seemingly perhaps unrelated grant opportunity. Other thoughts, questions, comments?
Just to add a little bit more to that statement you just made, I think it's really important, especially with the climate we have, is to make sure that we try to zoom out on our ideas and our thought processes and not really box ourselves into only our research interests, because that allows you to think a little bit more broader about the science. And of course, that's most important if you're really interested in making scientific discoveries and adding new knowledge to science as a whole. But also, it gives you another opportunity for more funding opportunities to pursue, or as others have already mentioned, industry opportunities or societies that you can consider applying to. But I think it's very easy to get so narrow focused on what you're interested in. And hopefully with just this comment, I can hopefully spark some thoughts to maybe think, how does my research or area of research apply to other areas? And that can be some other things to consider as well.
We'll take another 5 minutes here before we move on to Kim and Johanny. But one question or comment I had is, what are your experiences with the different formats that are sometimes required by some of these different foundations in terms of how you write your research proposal or the kinds of things you have to put in it? I see Tanecia is smiling there. Do you have some thoughts on that?
Oh, absolutely. It's really hard. Meaning, in the context of trying to condense all the ideas you have into a really small package and making sure that it can be communicated effectively, not to just scientists, but maybe even patients that might be on the panel. It's just, you just have to be very strategic about what you're saying. Again, I think it was mentioned earlier why you're the perfect person to address this particular question and how, again, how it aligns with the mission of the foundation. Those are really critical points to make sure that someone takes into account as they're preparing their application for applying to the foundation as opposed to NIH. I mean, it's similar, but it's not the same.
Something I can share is my experiences with Old Foundation before applying for any NIH was that that was a completely different form. So there are applications that you submit, they're only 3 pages, and they have a specified questions that you have to answer. There is no specific aim page, there is no approach, nothing. But there are the questions that they have put there, and you have like about 300 words that you have to provide the answer for that. And then they will just judge your whole application based on the answers you have provided for their questions, and that's it. Even like the approach part of it, like where you describe your methodology, it may not look like at all what you provide for the NIH. But what they want to know, sometimes they do not need much very detailed information, but they want to make sure you are aligned with what they want. And then there are some of them, they go through multiple screening steps. So you first are kind of submitting your letter of intent, then they will screen, and then you're invited to submit your full application. And then that's the point where you provide all of your detailed information there. But specifically the ones that I have worked on that they're very translational, there are questions about how you're going to translate that. What are the marketing opportunities, like how it's going to compete with the other products out there. So although you are proposing very basic research that you're going to do, you have to foresee at the end of the line how it's going to translate, and kind of as you write your proposal, you have to think and justify for all of that well in advance. So they see that it fits in their mission. If you are unable to properly justify it, they would say, no, it's not relevant. If it doesn't have an IP, for instance, potential, for some of the foundation, it's out of the box because they are looking for that specifically. For some of them, the potential for your program, even if it's a small, to fit in a bigger consortia that they are looking at for 10 years. For instance, the Gates Foundation fundings are like that because they have big programs that they are, for instance, looking to treat a specific infection in Africa, right? And they bring together all the people from different consortia. You are filling only a small part of it, but you have to justify that you can work with all of these people and be part of that mission. So I think the way you write your program and the way your proposal and describe it within the consortia, it's important. There are different levels to know what they really want. And I suggest if you are looking to apply for one, try to attend their information session because they will go through a lot of these on their information sessions.
Thank you. Indira.
Yes, just building on that, I think foundations work differently from NIH for sure. They have a small group of reviewers or directors. And so having a relationship with their representatives is very important because they have to know you and have been, working with you or seen you at meetings and so on and so forth. So I would say if you have any interest in applying for foundation funding, to yes, attend their information sessions for sure, but also reach out to them, discuss your research, get to know them, let them get to know you. And then when you're ready to submit for a specific RFP that comes out, then you're already going to be in a better position if you know that they're already interested. So I think that's very important. And speaking to what Zohreh just said, impact is crucial. Of course, impact is also important in NIH grants, but here the impact has to be very visible and tangible and very evident to a more potentially broader community at the foundations, and perhaps some of our representatives from the foundations can comment on that as well from their perspective.
Well, that's a beautiful segue, and it is at the bottom of the hour, so I would like to move on. Thank you very much. And we'll take other questions if you want to put them in the chat. We can keep the dialogue going. We'll figure out a way to do that. But I'd like to now move to our two organizational representatives and start with Kim Hollander. Many of you know her. She's a director of the Oxalosis and Hyperoxaluria Foundation. Just a real gem of an organization that's out there. I've learned a lot from hanging around them for the last couple of years. It's a patient-centered organization, yet they fund research, basic science research, and they get patients involved. Really some critical, innovative things here. So Kim, if you want to go ahead, if you have slides to share, go ahead. Otherwise, you don't need to. Just tell us about you and your organization and your funding opportunities.
Yeah, so I'm limited on slides just because I got hung up at the airport, so I'm in my car, so I apologize. But hopefully you can hear me well. So just to let you know, we're the largest private funder of research in the world in hyperoxaluria. So hyperoxaluria is just elevated oxalate in the urine. We focus on two areas. One is primary, which is the genetic form of the disease, and the other is enteric, and that's the non-genetic form, typically caused by fat malabsorption. So we're in the rare kidney stone space, and we're trying to make kidney stone sexy, right? So if it's not our disease, hopefully we can find you another place, because I know many other executive directors are looking for research projects to come in, like dense disease. They're chomping at the bit to have researchers like yourselves get involved. And then to Tanecia's point earlier, we also partner with larger organizations like American Society of Nephrology, and we have a career development grant there. So that started, I think, about 10 years ago. That's about a $200,000 grant. We put in $50,000 of our money, and the ASN very nicely matches it $1 to $1. So we get to stretch our dollars even further. But I highly encourage you to check that program out. And Christine, I'll make sure that you have that on the CAIRIBU website, because that's mission critical. We did not fund anyone last year because we didn't have any applicants come in. And that makes us sad as an organization, right? Because there's missed opportunity there. We want the next generation to be focused on our disease state, become a leading expert, because a lot of our senior experts are retiring, and we need to carry the torch, right? So on the basic side, it's similar to the NIH style. So it's peer-reviewed research. We're looking for novel, innovative, basic science platforms. And I think that what separates us from most organizations, to Christina's point, is we do these large collaborations. So I'm all about, let's share resources. And if I know one lab is working on something, and I know another lab that's working on the same thing, well, why don't we get you all together and really make the needle move, right? Because we want things to happen fast. So rare diseases take a really long time to understand. Our time is running out. Patients are dying in the process. And so it's mission critical to kind of move this thing forward. So I like to put together and connect the dots for my researchers. And I'm doing that right now. I was doing it this morning on the earlier flight I was on. And someone's interested in enteric, and he's actually a transplant surgeon that is looking at, why are we transplanting patients that have enteric and then that kidney is failing? And there's literally no literature out there, folks, right? There's nothing in the published papers. It's very, very limited. And so I'm working with him to sort of make those introductions. So the sky is the limit. I urge you to apply. We have grants up to $200,000 in basic research. And you can also put in a clinical research project. It's not that we wouldn't review that, but it does go through a rigorous review process. We have about 60 reviewers around the world. So they are your peers, and we do provide feedback. So unlike other organizations, we don't want you to go away with your tail between your legs if your grant didn't get funded. For us, it's about that mentorship. And now we're even working with resource challenged countries that wouldn't have maybe what we have here in the United States, to say, okay, your grant didn't tick off all the boxes, but let me give you about 5 of our leading experts to sort of guide you, right? And so that we can enable these under-resourced areas to have a better chance at success. The money is there. Apply, apply, apply.
I want to move on to Dr. Kugelman-Tonos first, but I want to make a comment on what Kim just said. feedback. So even if you don't get funded, it's still worth it. And I think everybody knows this, to keep writing the grant. We learn, and that's how you get better at sharpening your research questions and aiming your proposals more strategically. So that's a great point. I'm not sure if all foundations will give feedback, but you're saying OHF does, and so it never hurts you to apply, even if you don't get funded, because you're going to learn something for the next grant. Let's move on to Dr. Kugelman-Tonos, and then I'll open it up the same as I did before for questions and comments to both. Go ahead. I think you have slides, Johanny, that you'd like to show, or do you want us to put them up?
I do. I'm trying to figure out where I can share my screen, but I sent them earlier. I don't know if you guys have them.
You did. You should be able to share down at the bottom if you go to the green share button on the dashboard there.
I'm gonna move my. I'm gonna move.
And if you don't see it, then maybe I'll ask.
Yeah,
Okay.
it expanded on my other. Okay.
Let's try it.
Let me see. Can you guys see my screen?
It looks like it's starting to share.
It's sharing?
Now we see it.
Okay, perfect. Well, first I want to say thank you for having me over here. I'm very excited. This is such a great initiative, and the CAIRIBU community is just outstanding. I'm the director of research at the AUA, and just to briefly tell you about part of my role as director of research is to provide direction and tactical solutions to the Office of Research between the AUA, the American Urological Association, but also for the Urology Care Foundation. The UCF is the official foundation of the AUA. And the way it works is that the UCF fundraise, and then the Office of Research manage and disperse all the funds. I also serve as a subject matter expert for a research education team to develop stewarding a robust portfolio of research education, and also for the research grants team to make sure that there's adequate support in place for all the research grant programs. And finally, I also support the Innovation Nexus program. This is a new program at the AUA, and it's more for entrepreneurship, as an incubator, as an accelerator for innovative research. But again, I'm very excited to talk to you today about all the new offerings that we have this year. So the Office of Research supports the urology scientist community by offering funding opportunities that will help develop all research efforts. We develop research education, and we support also advocacy efforts, and we provide funding for urology investigators. But our overall goal is just to advance urological research and just to catalyze the advancement of healthcare solutions. So patients in mind always. Our office has been working very hard this year to find innovative approaches to better sustain and support this next generation of scientists, especially during all the research changes that are happening recently. We are afraid of losing a whole generation of scientists, so we want to ensure the future and success of urologic research. So together we're developing new strategies. We're trying to expand the career development opportunities that we offer. And this year we are including established urology researchers. We also try to improve our programs to make sure that we are listening to the needs of the urology community. And we're funding the full pipeline of research development from basic science all the way to clinical research. Some of the key areas to keep in mind when you're applying is that the AUA likes the understanding of the disease mechanism, the development of new therapies, and also optimizing healthcare delivery to our patients. Now I'm going to dive into research grants and investigator supports. Please keep in mind that I'm only going to talk about the mechanisms that the AUA Office of Research offer, but at the end I have a slide that notes all the programs and funding opportunities for the Urology Care Foundation as well, because time is limited today. So in partnership with the Urology Care Foundation, the Office of Research manages and administers more than $70 million in various funds and endowments, and it provides an average of $1.5 million in new research funding each year. Our money comes from endowments. This comes from individual donors, societies, AUA sections. They can come from temporary partnerships with industry, societies, and sections as well. For example, we had a partnership with Johnson & Johnson for the Innovation Nexus for Quick Challenge, Fire Challenge Award. It was $300,000, and the application was due, I believe, October the 3rd. It was a one-year partnership, but we're looking for innovative projects. And we have those temporal partnerships here and then. And we also have drawdown funds. This can be from operationals, leftovers from the AUA, or from individual donors. So for 2024, we supported 52 early career urologists. We also gave 31 awards to brand new early career investigators. So working with the UCF, we are right now the driving force, the top one funder for urology research outside government and industry. And we are really, really trying hard to keep expanding our offerings. We're trying to do more than just fund the best research from talented scientists. We want to help foster and develop their careers and support the strong commitment of finding that next breakthrough in patient care. So again, we're really trying to invest in talented physician scientists and see a return of investment, make sure that every dollar we are investing, it's put into work. So again, our goal is just to motivate individuals that have the potential to make important contributions to the urology field to remain committed to a career in urology research. So over the past 50 years, the Urology Care Foundation has invested nearly $40 million to support more than 1,000 researchers through grants, awards, and programs. And this is only what we have fundraised through the UCF. The AUA has additional programs. But again, we're just trying to fuel pioneer research in all areas of urology. There's not limit, and all stages of the research process, from basic all the way to outcomes research. And for 50 years, our goal has remained unchanged. We want to turn research discoveries into improvements in patient care. So just to give you a quick update, this year, we wanted to align our program with the needs of the research community. So the UCF Boards of Directors approved the creation of a new funding mechanism to celebrate the 50th anniversary, and that's called the Transformative Research Award. The AUA of Director also supported this initiative by giving $2 million grant to establish this mechanism, and we're right now fundraising because we want to match for a total endowment of $4 million. Once we are done with fundraising, this award is going to be competed, and this is aimed at established investigators. We want to encourage interdisciplinary collaborations to solve old urology problems through a new lens, basically. In addition, in response to the current changes in the biomedical research environment and the decrease in federal funding availability, we created a new Bridge Award mechanism to fill the gap that was left for by the removal of the NIDDK R21 awards. So the goal for the Bridge Award is to fund research projects that need further support to be successfully completed and to offer our researchers stability during unsteady times. So the funding is unrestricted, it's flexible intentionally, and it's available to cover whatever the researchers need to keep their projects going. So this looks like a busy graph, but this is what we have right now in terms of support from the Office of Research. We created a portfolio of awards that includes mentorship and training, and now it's supporting the next stages of urology research. So covering the entire career pipeline, we have medical students, residents, postdocs, clinical fellows, junior faculty, established investigators. For medical students, we have two mechanisms: the Medical Student Fellowship. It provides support for mentor research ranging from 10 weeks all the way to 12 months. And the Boston Scientific Innovation Fellowship, and that awards a total of $40,000, 20 from the award and 20 institutional match, and is for a year research project. For residents, we have two mechanisms: the Residency Research Award and the LEAD Award, and they're aimed at supporting residents while they work on a project between 3 and 12 months in length. It has to be mentored, so you need to have a mentor, and it provides $10,000 for supplies. The Research Scholar Award and the Rising Star is to help early career investigators during that period of transition into research independence. The Research Scholar Award provides $40,000 for research supplies, and the Rising Stars Award covers salary for up to $200,000. And now, again, for the first time in 50 years, we're supporting our independent urology researchers by adding the Bridge Award, and it's aimed to support those researchers that are facing financial hardship, recognizing the financial shortages and how hard it is for investigators, and the Transformative Research Award that is aimed at established investigators, again, that are looking to pursue multidisciplinary approaches to urology problems. So now I want to talk to you about the application process. So for the 2025 research grant season. And again, this is what we have right now, but we're always trying to streamline the process. So as of today, this is how the process is. We start with, I'm so sorry. We create the program announcement, then it is released to the public about 8 to 12 weeks prior to the due date to make sure that we give investigator and candidates enough time to collect all the signatures and create a nice application package. The Office of Research has a team that performs compliance checks, and then we do a peer review. Our peer reviewers are members of the urology community, they're researchers, physicians, and they have the experience and expertise that's appropriate for the funding mechanism to be evaluated. If we're looking at a medical student funding mechanism, it's okay to have a fellow doing peer review. But when we have an early career investigator, we're looking at our established investigators doing peer review. So we choose the reviewers based on the mechanism and the area of expertise. Our peer reviewers score the proposals based on scientific merit and how they fulfill the goals and requirements on the funding endowment. And this is very important because not only the scoring is evaluated, but some endowments are specific for a topic, for example, prostate cancer. So you can have an outstanding proposal, but if it's bladder cancer, you cannot be selected for this specific endowment. So we have multiple endowments for funding mechanisms. For example, for the medical student fellowship, this year we have about 14 awards because 14 endowments were ready to be competed. Sometimes it's 18, sometimes it's 22. But we have multiple endowments per funding mechanism, and each one of them might have specific requirements. And all that information is on the program announcement. And then finally, the notice of awards are made once the awardees are selected, and payments are issued to the institution or the individual, depending on the funding mechanism. Some of the funding topics for 2025 included urologic cancers, kidney health, development, sexual dysfunction, benign conditions, and many more. So it's pretty easy to apply. You just go to the AUAnet.org website. On the top right side, you're going to see it says research. Then you go to the menu on the left, you select research grants or awards, and then you select the funding opportunity that you want to apply to. Once you click on the card for that opportunity, you will have another pop-up page with more information and the program announcement. It also have the email for our Office of Research, so please feel free to always reach out to us. We have 3 upcoming mechanisms.
I just want to interject. We just want to wrap up so we have time for comments.
Yeah, this is the last slide, I believe. We have 3 mechanisms that are coming. They're there. And these are the programs for the Urology Care Foundation I was letting you know about. We have 4 all the way from clinical education, patient education, humanitarian programs that pay for trips to Trinidad and Tobago, and multiple other programs. So please check out their page. And last but not least, I want to leave this up so you guys have the contact information. No question is a bad question. Please reach out. We want to hear from you. We want to hear what you need. We want to hear what is happening with you in terms of funding, so we know what the community needs when we create more mechanisms.